Thank you, Professor Nolte, for the kind introduction and for the invitation to Bern. This chronic stroke patient has several impairments that affect his arm. There is a reduced control due to the hemispheric brain lesion, muscular weakness, swelling and abnormal shoulder-elbow synergies. These impairments lead to functional limitation which cause disability and can result in a decrease in social participation. Let me give you an example. Before the stroke, this patient was very much into playing cards. After the stroke, he was complaining a lot that he couldn't play anymore. Due to his multiple impairments, he can't open and close his hand in a functional way anymore. Therefore, he can't play cards, and as a consequence, he doesn't see his friends as often as he did before. There is a positive feedback loop. Being less active will have a negative influence on his physical and mental fitness and make things worse. Since alone in Switzerland, each year more than 12,000 people are affected by stroke, there is an urgent need for better treatment options for these patients. That is why during the last 8 years I have been using engineering methodologies with the goal to study stroke and to improve the rehabilitation process. I will show you robotic technology that can measure and quantify impairment and that can improve therapy and functional outcome. My objective for this talk is to show you that there are similarities between stroke patients and elderly people, and that some of the methods and techniques that I have developed for stroke will be useful in geriatrics too. Talking about geriatrics, our society is getting older, the numbers are scary, and we all agree that dealing with the graying of the population will be a major challenge to be faced in the near future. Observe this 93-year-old lady. She has several age-related impairments that can be generally described as reduced fitness and overall health. Her impairments lead to functional limitation and to disability. In many ways, her functional limitations and disability are comparable to stroke patients and limit her in her daily activities. One example is sit-to-stand and overground walking. She is unstable and she has an increased risk for falls. As a consequence, she is afraid, she doesn't go out, and she reduces her participation in society, which then again leads to further physical and cognitive decline. So that is the problem. What do we want to achieve? I think the goal must be to find new ways to support the elderly in their aging process, leading them to successful aging. Successful aging can be described by its three main components, which are low risk of disability and disease, high cognitive and physical function level, and high level of engagement with life. I will present you two possible research directions that I am very interested to work on here in Bern. Both are centered around successful aging with focus on safety and mobility. But let's first talk about stroke. In rehabilitation hospitals,